Here we go.
Are we going?
We are going.
Okay. Hi, my name is Courtney, and I am demonstrating the trach care and suctioning. This is Mr. Johnson. He is our patient today, and so I will introduce myself to him, and then I will explain to him that we are going to go ahead and clean his trach, and then we're also going to do suctioning for him. And so we're going to go ahead and get started.
Do you think that they would have let you do trach care?
So the first thing I'm going to do is I'm going to go ahead and check his skin color, make sure he doesn't have any cyanosis. I'm going to check his mucosa, make sure that it's pink like a bubblegum color, not white or anything like that. If it is white, then that means his oxygen saturation is pretty low. We're going to go ahead and have an O2 monitor on him during this process. And we're going to make sure that we have an ambu with us for when we start the procedure. And we're going to go ahead and I'm going to take the syringe. I'm going to go ahead and pull on this to make sure that there's plenty of air inside, and there is. So I'm going to go ahead and push it back in, so it means that there's enough air for the trach to stay in place. And so the first thing I'm going to do is I'm going to go ahead and I'm going to remove this up to his mouth. So I'm going to go ahead and with my clean gloves, I'm going to go ahead and remove the current gauze that's on there and discard it. So I'm going to ask my assistant, what's his O2 stat at this time?
His O2 stats are holding solid at 96%.
Okay, thank you. Okay.
I'll maybe put it up by his nose. There you go. If it stays, there we go. Perfect.
Okay. Okay, so now that I've removed that, I now need to take off these clean gloves and don some sterile gloves. Clean my hands real quick. I'm going to go ahead and open these up. Okay, so this inside is still sterile, so I'm going to go ahead and be able to remove it.
Okay, so you're going to videotape.
Okay, so I'm going to go ahead and take this, open it, and pour it in because it is sterile. It came out of the sterile pack. So I'm also going to go ahead and I'm going to make my little flowers. Okay. What's his O2 stat?
His O2 stats are holding solid at 96.
Great. Okay, so the first thing I'm going to do is I'm going to go ahead and I'm going to take this out so we can get it soaking. Okay. So now I'm going to go ahead and take this. I'm now going to contaminate my left hand, which is my non-dominant hand. I'm going to keep my right hand sterile. So I'm going to go ahead and clean one swipe. Make sure there's no, discard that. Get a new one. Go up underneath. Okay, one swipe, discard. I'm going to get a new one out. I'm going to go ahead and clean this cannula, the cannula seating. And then I'm going to discard this, get a new one. I'm going to go ahead and clean the outside of this, discard it, get a new one. I'm going to go ahead and clean the outside here, discard this. And then I'm going to go ahead and grab a gauze. I'm going to wring out all the excess water because we don't want any chances of any of the fluids going down inside the trach. So I'm going to go ahead and take my non-sterile hand. I'm going to go ahead and push in on the bracing a little bit so I can make a little room, make one swipe. I'm going to discard this one, get a new one. I'm going to push down on this side and do the same. Discard it. I'm going to get a new one. And then go underneath and wipe. So I'm going to discard that. And I'm going to get another one. We're going to go ahead and wipe that way. And I'm going to go ahead and discard it. Now it's time for me to go ahead and get it dry. So I'm going to take a dry one. And I'm going to keep it in my sterile hand. And then I'm going to go ahead and do the same thing as I did, but I'm going to pat it dry from inside out. I'm going to discard this, get a new one. And pat dry. Discard this, get a new one. Discard, get a new one. And discard. Okay, so the next thing I'm going to do is I'm going to go ahead and I'm going to take my sterile hand. I'm going to get my cannula out so I can clean it. I'm going to go ahead and run this all the way through to make sure we get all the gunk and mucus and stuff out of it. I'm going to leave that in there. So then I will go ahead and lay it in its bath. And then I can also take some of this and pour it out, make sure that there's nothing in there. I'll do that if there is any, if we use any peroxide or anything like that, to make sure that the peroxide is completely rinsed off. So I'm also going to go ahead and take a, pipe cleaner. I'm going to go ahead and run it into the tube to dry out the inside of the tube. And then I will take my other gauze and I will go ahead and dry the outside of the inner cannula. And then once that is completely dry, I am now okay to go ahead and place it back in place. You know, and I forgot to do the sectioning. So we're going to go back and section.
You could actually section with it or without it.
I can I? So I'm going to go ahead and place that in. Alright, so I locked it in place. So what's his O2 stat?
His O2 stats are at 95.
Okay. Put that on there. Okay, so with my sterile hand, I'm going to go ahead and continue to grab this. And then with my non-sterile hand, I'm going to go ahead and grab the tubing. Plug that in. Make sure that it's out. Okay, so I'm going to go ahead and turn the machine on with my left hand. Down, and then I'm going to count at the maximum 10 seconds. Okay, so I'm going to cover this in 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000. Okay, so I'm going to go ahead and come in, suction it, make sure it's clean. And I'm going to do it one more time. I'm going to go down without covering the little hole. And then I'm going to back up just a little bit, cover it in 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. Okay, so now the trach is clean. So I'm going to go ahead and turn the machine off.
And I'm going to put this back.
Yep. So now I'm going to go ahead and on the other hand. Okay, so I'm going to go ahead and pull this off and throw it away, making sure that my hands stay up at waist high. So with new clean gloves on, what I will then do is I'm going to go ahead and place the new pad on. So once I don new sterile gloves, I will go ahead and fold this up. Go ahead and place the tube 5 inches O2 saturation into her trach left side. Alright, will you perform a couple respirations with the ample check? Where's the O2 stat?
We're at 96.
Okay. So what I'll do is I'll go ahead and lay it down. Alright, everything looks clear, Mrs. Johnson. And what is our saturation? 96. And we've waited a minute between the suctioning. While keeping the glove sterile. Okay, now I'm still sterile. And Mrs. Johnson, we're going to try to get back in. How's your O2? 95. 95? Okay. Okay. Now that that is back in place, then what's the O2 stat?
We're holding steady at 96.
Okay, thank you. So I'm going to go ahead and I'm going to put on a new tie band. I'm going to go ahead and tie it up and around onto this side. Once I get the new tie band on, I will go ahead and untie the old one to discard. Alright, Mr. Johnson, so I'm done cleaning your trach, and we did a suctioning on you. Your color looks good. I don't see any kind of a cyanosis or anything to be of concern. The mucosa membrane does not look white. It still looks bubblegum pink. And that's it.